My name is Serena Nelson, and I am a junior studying health science and psychology at Carroll College. I did a systematic review on neurofeedback training as an intervention for children with autism spectrum disorder. The diagnosis of autism spectrum disorder has been on the rise for the past 20 years. In the last 10 years, the diagnosis of ASD has gone from 1 in 110 children to 1 in 68 children. In 2015, 1% of all children received a diagnosis of ASD before the age of 18. Despite these increased rates, no cause has been established for the disorder. Furthermore, no treatment has been created to address the disorder and all its symptoms. Symptoms experienced by children with autism spectrum disorder include deficits in three main areas, which are social, cognitive, and behavioral. Socially, children with autism show decreased ability to understand intentions, imitate actions, express empathy, and express or understand facial expressions. Cognitively, these children may struggle to communicate effectively with others, both through expressive and receptive language, engage in shared attention, and they often show limited interests. Children with autism may also engage in repetitive, aggressive, or self-injurious behaviors. Although the exact cause of autism is unknown, research suggests that autism may be the result of irregular brain activity, specifically in the mirror neuron system. This system is responsible for imitation and is associated with social cognition and environmental perceptions or awareness of surroundings. These irregularities or deficiencies cause delays in development and can lead to behavioral problems. Biomedical interventions and pharmaceutical treatments for autism spectrum disorder do exist, but they often come with side effects and do not treat the full range of symptoms. This has left parents and clinicians looking for less invasive or risky treatments that can produce a long-term decrease in symptoms. Research suggests that neurofeedback can produce brain activity in children with autism that may modify social, behavioral, and cognitive capabilities without the negative side effects that can occur with current treatments. Neurofeedback training is designed to teach people with autism to control their own brain waves. Practitioners place several electrodes on the scalp of participants and monitor their brain activity. They then use some type of visual or auditory feedback to reinforce the brain waves that resemble that of typically developing children. So they might use a game or a song and the volume might increase, or their lights might pop up and they might earn points as they go through the activity and their brain waves are regulated. This helps children learn how to produce brain activity that may produce behavior that is comparable to that of typically developing peers. The purpose of this study is to review research on the changes in social skills, cognitive ability, and behavior in children with autism spectrum disorder after receiving neurofeedback training for specific amounts of time. PubMed and CINAHL were used to find primary resources for this systematic review in September and October of 2020. Inclusion criteria required the research articles to have studied children under the age of 18 with a diagnosis of autism as specified by the DSM-V5 criteria. Different techniques for administering neurofeedback training were used in the different studies and measuring its effectiveness. These differences were outlined within the studies. The 6 articles chosen for analysis in this study included 4 case control studies and 2 randomized case control studies. All articles included reviewed brain activity using EEG measurements, and each study involved a questionnaire filled out by parents regarding symptoms prior to the start of treatment, and then again at the completion of the study. Parents of the participants reported decreases in repetitive and disruptive behavior, increases in social ability, and an increase in the ability to focus on tasks. One study included protocols where participants documented their change in symptoms, and the participants reported an overall decrease in symptoms. The included study showed an overall improvement in cognitive functioning, social capabilities, behavior, and normalized brain activity when comparing pre-intervention examination and post-intervention results. This review finds that neurofeedback may be an effective intervention for children experiencing behavioral, social, and cognitive difficulties associated with autism spectrum disorder. As autism rates continue to rise, it is vital that effective and safe treatments are made available, and that these treatments are options for many different families with children with autism spectrum disorder. It is also important that the intervention addresses the wide range of symptoms children with autism face, rather than just a specific set of symptoms within the social, cognitive, or behavioral area of these symptoms. As evidenced by the studies included in this analysis, neurofeedback produces changes in brain activity, and then once the brain activity is measured after treatment, it is more similar to that of typically developing children than it was prior to treatment. No negative side effects for neurofeedback training were reported in any of the studies, although some of the studies, two in particular, noted that some participants had a difficult time with transitioning to the start of the session. And the researchers stated that it wasn't necessarily the protocol of the specific neurofeedback training. It was just that that is one of the symptoms of autism. Transitions are often difficult with those children. And so this treatment is not different in other types of treatment, but that is a difficulty faced when trying to implement it. In comparison to other treatments for autism, it had less worries from the parents as well as clinicians, providing that it could be a positive alternative to conventional and current autism spectrum interventions. All 6 articles concluded in support of neurofeedback training as an intervention for children with autism. Many different implementations of the neurofeedback training were included, and they all showed similar success, whether it was neurofeedback training done by an auditory or visual realm, whether it was done in the clinic or the home. They all produced similar changes in brain activity as well as social, behavioral, and cognitive factors that they tested. This also suggests that it can be used to treat the wide spectrum of people affected by autism. So it could be used for younger and older children, as well as higher and lower functioning children on the spectrum. 2 of the studies looked at high functioning and low functioning children, and they recorded improvements in both groups after receiving treatment. This again supports the validity of this intervention, as it can be applied to a widespread group of people affected by autism. In the future, to improve upon existing research, studies should follow participants for a longer period of time. These studies were pretty limited in time. They just measured symptoms right prior to conducting treatment, and then throughout the treatment, which some of them went as long as 3 months, and then there was no follow-up after that. The studies did not address whether participants needed to undergo continued neurofeedback training to retain these improvements. If studies had longer follow-up with participants, it would show whether these improvements were sustained over time or if it required continuous participation in sessions to result in optimal outcomes. This review found evidence that supports the use of neurofeedback training to decrease cognitive, social, and behavioral deficits associated with brain activity abnormality found in children with autism spectrum disorder. Parents reported a decrease in symptoms after the children participated in the study. Brain activity normalized and matched that of brain activity of typically developing children as measured by EEGs. NFT may prove to be an effective and safe intervention to help provide improvement in the quality of life for the many children who are diagnosed with autism spectrum disorder.